are that demographic that's changing and using it the most, 55 and above.
Yeah.
The time women, we do get a lot of men, but women are usually the decision makers in their family as far as medicines and treatment is concerned. So we have women dragging in their husbands or their teenage kids or grandchildren, but we see all ages. We've seen from 8 months up to 99 years of age.
Wow.
All sorts of medical problems and on like pages of medications, and they're tired of those medications and want to know how to get. All of them are trying to get off
Yeah.
long list of pharmaceutical drugs. And so, yes, we see them all, and we start the same place. Food is your first medicine. Let's look at what you're eating first, because I can tell you, you can go to your spice cabinet, and half of those spices in there are going to help you out if you know how to use them.
Yeah. You must, speaking at retirement communities, Corinne and I would always ask how many people are using medical cannabis, and it's funny, years ago when I first would go in there, or we would go in there, I'd ask how many people think the only way of consuming medical cannabis is via smoking. And back in the day, when I say back in the day, 2011, I would have 80% of the room would raise their hand thinking that the only way to consume medical cannabis is via smoking. And when I'd share the different, the benefits of and other modalities of tinctures and topicals, vaporization, oils, their mouth dropped. This one lady said, I have lung cancer, and I thought the only way I can use it is via smoking a joint or from a pipe. And so, do you share? I mean, I know the answer. I mean, can you share how you talk and inform your patients about the benefits of tinctures versus smoking? We have a lot of patients that are moms, as you mentioned, that come in, or dads. They have to work, they have responsibilities, picking up the kids, going to school, driving here, driving there, and they can't take a certain formulation in the daytime. What do you recommend to patients like that?
Yeah, that's a very good question. And we do recommendations depending on the disease process they're coming to us with, and what their day need to be like. So we do need to ask them, what is a typical day for you? What responsibilities do you have? Do you need to go to work, or do you have to shuffle kids around? Because we're going to recommend the formulations they use, when they should use them, and sometimes even how they use them. So we do like to tell patients, we want you to use the method that's easiest and most convenient for you. And you're right, most people think it's smoking, and they're very surprised when we talk about oils or salves or creams or suppositories or gum, and they're really shocked about that. But we talk to them in terms of, we're physicians, so we say, well, for the disease process that you have, let's talk about therapeutic level, blood levels of what we need to get for you. So we talk to them about the methods of intake and how it affects the duration of action of their product, and also how long it takes to onset. So those who need a quick something, and we don't usually push smoking or vaporization, but if someone needs to go to sleep at night, insomnia is a problem, then we'll tell them take a hit on the vapor, and then put something long acting on board that's going to let you sleep for 4 to 6 hours. So nasal septum has the highest therapeutic level, blood levels. Next come the suppository, rectal or vaginal. Third is sublingual, or rubbing into the gums, or buccal in the jaw. And then a distant fourth is the GI tract. And these all have 4 to 6 hours, maybe 8 hours duration of action. Some of them have quicker onsets. The GI tract is 90 minutes to 2-hour onset of action. But if you take it in the nasal septum, or rectal suppository, or sublingually, or in the buccal mucosa, it's like 15 to 20 minutes onset of action. So all those things we need to take into consideration. Now, if they need to be functional during the day, we're generally going to push them toward, start with your CBD, and we'll give them what we call the daytime terpenes, like limonene or alpha-pinene, something that uplifts their mood and mental clarity. At nighttime, we'll say, well, let's add your THC if that's what you need, but the terpenes like myrcene and linalool, we're going to give to them at night, because we want them to be functional. It's all about the quality of living. We don't do anything that takes away that quality of life for them. If they need to work, they need to work. And so we try to create a program for them that allows them to best reach their goals.
Can you mention, excuse me, can you talk about nasal septum administration?
Yeah, once again, we're using the oil to rub into the nasal septum. They just need to rub it into the septum, and it's great absorption. It's very vascular, and it gives you the highest therapeutic blood level is via the nasal septum. Now, my only thing about that is folks don't like smelling that all day long. So usually if a person's are really debilitated and we can't get it into them any other way, somebody like a stage 4 cancer patient, then we may use it nasal septum and
Yeah.
the suppository. But usually we're telling patients to take it two different ways. Like if you're going to use an edible, and then use it under the tongue. So we want to get that therapeutic blood level in. Or if they want to use it to smoke it and vape it, we're telling them your duration of action is maybe 2 hours, but we need you to take something long acting. So we're going to tell you take it, do your vaporization, but take it, as sublingually or nasally if they can tolerate the smell, or under the tongue, whatever way that's easiest for them to do that. Patches is another way. People can use the
Yep.
patches, which works very well for people.